about 70% of women develop non-cancerous tumors in their uterus, known as uterine fibroids. They're extremely uncomfortable and painful. There's a place here in the Coastal Bend that is working to help relieve that pain with a minimally invasive outpatient procedure. So I have Dr. Lee here with VasCare to teach us a little bit more about uterine fibroids, what they are, and whether or not you may need to contact somebody like himself for help. So thank you so much for being here with me today.
Well, thanks for having me.
Absolutely. I'm learning about this for the first time. What are uterine fibroids and why should I be concerned about them?
Uterine fibroids, super common abnormal growths that happen within the uterus. Most women know that they have them already. They're seeing a women's health care provider, whether it's their OBGYN or family practice doctor, and they're usually pretty symptomatic because they're tumors, which are benign growths of the uterus. They're either causing mass effect, pressing on the bladder and the rectum, leading to frequent urination and constipation, or because they're very vascular, they're leading to very heavy menstrual cycles, and so they're seeing providers because of these problems.
Okay, so you just named a few of the symptoms we may be looking for. Are there some peak cases where there are no symptoms at all?
There are 1 out of every 2 women has fibroids. Some studies show 4 out of every 5, but out of the women that have fibroids, roughly 30% become symptomatic enough they need some sort of treatment.
Okay, and so once we establish that we have them, we need the treatment, what are the options there? Are there a few or is there only one answer?
There's many treatment options. Some can just be managed with medication. Hormones are a treatment option for many women. However, there's some side effects. And then there's surgical and minimally invasive options, which is what uterine fibroid is. Some of the surgical options most commonly is going to involve some sort of major surgery to the uterus. Safe, but also a long recovery. We offer a very competitive, safe, minimally invasive option. It takes about 30 minutes, and we go in the arteries in the wrist or the groin, go directly into the fibroids, use some microscopic beads that will go into the uterus. I actually have some examples here.
Okay.
Just in this syringe, we can treat one, if not the entire, both sides of the uterus.
Wow.
They shrink away, and within a few months, they're back to like they never had fibroids.
Interesting. So with some of these treatments, if somebody's looking to have children in the future, that's still going to be an option for them?
It is. I never guarantee fertility, but when you look at some of the retrospective, which means looking backwards, of women who did get pregnant after fibroid embolization, their fertility rate is about 65%. A normal woman in America trying to have a baby is roughly 75%.
All right.
So you still have that option available.
Great. Not that far off. So if I'm needing a referral or I want more information, I want to get myself checked out, who do I look to?
Well, I think the first person they should start with is their women's health provider. They're great partners in the community, either their family practice or OBGYN. They should know how to refer to us.
Okay.
There's also a self-referral process, which they can find me online on our website.
Fantastic. Okay. And you yourself are one of the few or the only doctors that offer this procedure here in the Coastal Bend?
In the Coastal Bend, yes. It's actually a very common procedure done in all major cities in America.
Well, we appreciate you doing your part to help raise awareness. As a woman, I definitely am walking away with a lot of useful information. Hopefully you guys learned a thing or two as well. And you're very credible, especially if you've taken a part in some of the solutions here. So how do we get in touch with you?
Again, see your primary care or women's health care provider. Do some research on us online. Do your due diligence. I'm happy to see any woman who just wants to learn a little bit more in person, whether or not you choose that option, just to give women a choice. I think that's what women really want.
Absolutely. Well, thank you for all the information today and the difference you're making in these women's lives. If you need assistance, obviously call the doctor himself or find a way to get to him. And of course, mention Coastal Living sent you.